Okay. Good afternoon. Hello. Hi. Hi. I'm Dr. Nesbitt. I am Vice President for Institutional Opportunity, and I'd like to welcome you all today to the second lecture for this year, our first of the Health Disparities lecture series for 2026, and it promises to be nothing less than absolutely excellent. So hold on to your seats and get ready, because we have an absolute superstar here to speak for us today. As you know, these talks, we collaborate together between my office and Institutional Opportunity and the School of Public Health. Dr. Omer and I put together lectures that we think will be interesting, inspiring, and also facilitate the growth of our institution and all of our members here. It's a pleasure to have you all with us, both in person and online. This will be recorded on YouTube, so you can always go back and listen to it again. So now a little bit about our speaker. Catherine Coleman Flowers is the founder and CEO of the Center for Rural Enterprise and Environmental Justice, CREEJ. She holds an honorary Doctor of Environmental Science from Wesleyan University and is a recipient of the MacArthur Genius Award 2023, Time 100, Forbes 50 over 50, Forbes inaugural 50 Global Leaders in Sustainability, and is a 2025 recipient of the Time Earth Awards. In addition, she serves on Broadway's Green Alliance Advisory Council, as a board member of the Climate Reality Project and the Natural Resources Defense Council. Flowers is the author of Holy Ground on Activism, Environmental Justice, and Finding Hope, Waste, One Woman's Fight Against America's Dirty Secret. And she's been featured in The New Yorker, The New York Times, and 60 Minutes, and she was on the cover of Time Magazine's 2025 Earth Awards edition. That's a lot, right? And so young. It is really my honor, and we have several signed copies of the book, and if you were one of the first 25 to arrive in person, you will receive a signed copy of her book. It is also available otherwise for you to purchase. We couldn't give everybody a book, but we are so glad that you are here with us. Without further ado, Catherine.
I can't remember whether it's morning or afternoon, but good morning. First of all, thank you, Dr. Nesbitt. This has been a blessing for me to be here, and this is my second opportunity to be here at UT Southwest. It is, I had to ask the question whether this was the football school, and I was told that it wasn't. But the reason why I asked that question is because I have a cousin who is going to be going to the other University of Texas. He left Auburn University where he played football there and decided he was going to come here to Texas. So for those of you that are football fans, please cheer for Cam Coleman when he suits up for the University of Texas. But I bring you greetings from Huntsville, Alabama. I am a native of Lowndes County, Alabama, which is located between Selma and Montgomery. For those of you that may not know, because I know I'm talking to a lot of young people, there was a march in 1965, the Voting Rights March, that was led by Dr. Martin Luther King, and most of that march went through Lowndes County, Alabama, which is where I'm from. Lowndes County is a very, very rural community. Because it's so rural, a lot of things that I had the opportunity to experience, I didn't realize that it didn't happen everywhere. I thought it just, that was just norm. And I've learned that those experiences that I gained growing up in rural America have really helped me with the work that I do today. I'm going to talk to you about a few things today as it relates to health disparities, but I'm going to do that through storytelling. I find that it's easier to keep people's attention when you're telling a story sometimes than when you're showing slides and you're not giving a test on it. So it is easier for me to do it this way. But I'm going to start off by just giving you a little bit about my experience growing up in Lowndes County, Alabama. We grew up in an area, Lowndes County's history is that it was founded by people from South Carolina. When they started to expand westward, Alabama was one of those areas that they went to because, you know, Alabama was not one of the 13 original colonies. But as they planted cotton, cotton wore out the soil, and they had to find other places in which they could plant cotton. And that, of course, was, in our case, Alabama. A lot of people, if you go to Lowndes County, and at one point they used to have a Civil War monument there in the middle of the town square. Most of the people that were listed on there were born in South Carolina. So, in South Carolina at one point had the most slaves of any other area in what was then the United States of America. So, Lowndes County was one of those places that grew a lot of cotton. And after the Civil War, there was a fight to determine how could they control the labor. They didn't have AI back then to pick cotton, so they had to figure out whether or not how they were going to control the people that they had worked before without paying them. And that's when they came up with a process where they had sharecropping. With sharecropping, you live on the land, but you had to go to the store. It was almost akin to working in a coal mine and living in a company town where the person that owned the plantation pretty much controlled that process. In controlling that process, a lot of people wanted to escape that. And what they did was they bought their own property. A lot of people bought their own property, and the property they would sell to people in Lowndes County was not the best property. They sold them the property that was the swampiest or wasn't good for growing crops in some cases, and certainly wasn't good for sanitation. So if we fast forward to the present times, I had the opportunity to eventually, as I taught history in middle school and high school, I had the opportunity to go back to Lowndes County. But this time I wanted to go back and doing my own thing as a consultant, and I wanted to do economic development. In the process of trying to do economic development, I found out you can't do that without infrastructure. Hyundai had decided it was going to build its first plant in the United States, in Alabama, in Montgomery. And as we tried to recruit the plants to come to Lowndes County, we realized that without having wastewater infrastructure in place, without having natural gas and some of the other things they required, we were not going to be successful. So I ended up learning how to partner with folk to make these things happen, and we were able to recruit 2 Tier 1 suppliers to Hyundai to come to Lowndes County, Alabama. But in that process, we found out that a lot of residents didn't have the infrastructure either. And a lot of people had raw sewage on the ground. I don't know if you've ever been in some of these rural communities. When I grew up in the country when we didn't have access to indoor toilets. We had what people at that time called slop jars or night pots. And that's what you use, and then the next day you would take it out into the outhouse, which was the bathroom. And what I didn't understand as I started, doing this work is the connection between what was happening then and what is happening now in terms of our work around water and sanitation. So in the process of trying to recruit and make sure that we could get what we needed in Lowndes County, I had to deal with wastewater. I had to deal with sanitation. When I first started dealing with this, they were arresting people. Actually, the State Department of Public Health was arresting people in Lowndes County who could not afford on-site sanitation. Most of those people were descendants of the folk who had worked the plantation. In some cases, they had paid for septic systems and they didn't work. So as a result, it led to a lot of problems. And we didn't realize, as we were advocating and trying to change this situation, we didn't realize how this was connected to health. And what I'm getting to, what I'm leading up to is showing the connection between infrastructure, especially sanitation, water and sanitation infrastructure and public health. And what we found out was this was an issue that has been going on for a very long time. And someone gave a book to me to read, and they said, you should read this book. She said, and I don't remember the name right now, but he said, you should read this book because this book will help you understand what's going on. And when I read this book, I read about the Rockefeller Sanitation Commission. A lot of you have probably heard of the Rockefeller Foundation. Well, the Rockefeller Foundation came about as a result of the Rockefeller Sanitation Commission. And the Rockefeller Sanitation Commission was set up because the Rockefellers had invested a lot of money in factories where their workers were getting sick because of hookworm. And they were starting to look at hookworm in a lot of areas, especially in the South. And when they found out that a lot of people were being infected with hookworms, they tried to come up with a way to treat it. And that's what led to the rise of public health in the South. They came up with ideas in terms of how do you treat it, because what people were doing at that time, especially in rural communities, if they had to use the bathroom, they would just go beside a building or whatever and do whatever they did. They didn't have access to what you may have seen in cities. As a result, a lot of people were getting sick. And they had already started to build some form of sanitation infrastructure in the urban areas, but the rural communities were left behind. So we started, in this process of looking at what was happening in Lowndes County around sanitation, we started looking at what are some of the potential health consequences. Because as I was talking about wastewater problems around the country and what was happening in Lowndes County, nobody really kind of understood it yet until I saw an article that was in the New York Times. And it was an op-ed that was written by Dr. Peter Hotez at Baylor's National School of Tropical Medicine. And he talked about the possibility of tropical illnesses being here on our shores. And in that op-ed, one of the things he mentioned was wastewater. So I decided I was going to Google him and see if I could find some contact information, which I did. And I emailed him and I asked him the question, is it possible that American doctors are not trained to look for diseases caused by sewage being on the ground because the United States won't acknowledge that we have raw sewage on the ground in this country, that this is something that happens in other countries and not here? And he said yes. And out of that came the parasite study. The parasite study was published in 2017. And in this parasite study, we were able to show that hookworm and other tropical illnesses were associated with sanitation, with the lack of sanitation. And as a result, we also found out that something that they thought was not in the United States did exist because the Rockefeller Sanitary Commission said that they had wiped out hookworm. But this is what we found out. When I went back and looked at the Rockefeller Sanitary Commission and how they treated hookworm, or how they tried to figure out where it was and then treat it, I started looking at what they did in rural communities. So I found that there was a Black Medical Association. The president of that Black Medical Association was at Tuskegee Institute at the time. and he had been contracted by them to do a survey to find out who was infected with hookworm. And what he did was he sent his survey out to doctors. He sent a survey out to doctors asking them had they treated anybody with hookworm. And of course, only one doctor came back and said he had treated 5 people. So what was the flaw in that study? Well, first of all, we're talking about the first part of the 1900s. How many black doctors were in rural communities? We've probably got a few more now than we had then, but certainly there were very few black doctors that were working in rural communities. And the doctors that probably did see hookworm were probably from people that were part of the Great Migration and went to St. Louis, and he happened to treat them and found out they had hookworm. So based on that, I surmise that there's a possibility that we never really wiped it out because we never really wiped out the problem. And people feel sometimes the way to treat a problem is to just give people medicine. But if we don't deal with the infrastructure issues, we're going to continue to have health problems. For an example, if you look at Flint and what happened in Flint, Flint was because of flawed infrastructure, and the water that they sent through those pipes lifted that lead, and it ended up in the homes and the bodies of people that ingested the water. And as a result, there was a major problem, and we see Flint as kind of it was a flare that went in the air to let people know about what environmental injustice and health disparities look like. A lot of these disparities are exacerbated by the lack of adequate infrastructure. And the lack of adequate infrastructure can lead not only to health disparities, but it also leads to poverty. And when we looked at the UN Sustainable Development Goals, one of those Sustainable Development Goals is the human right to water and sanitation. And as we were on our journey and we were trying to figure this thing out and how to message people to understand the connection, it was only when we made the connection to health that folks started to understand that this was a problem. So we did the parasite study with Dr. Hotez, and there were some lessons that came from that parasite study. And this morning we met with some fellows here that are doing some important work out in the community. And I'd like to applaud you all for that, because in order for us to get to where we need to go, we have to have sustainable community engagement. And in our efforts to do this, one of the things that was important about the study we did with Baylor is that we co-designed that study with them. I am not a medical doctor. I do have some understanding of science, obviously. I knew how to ask the right questions. But I also had connections in the community. I was from the community. I had worked in the community before. And a lot of what I knew about the sanitation problem, I knew about it because I listened to people in the community. So when we decided to do this study and we co-designed it, we knew that there were certain things we could not do. First of all, we had to make sure that folk had the ability to express to us what they really felt and not feel targeted. So we had to make this study anonymous. We assigned numbers to people instead of putting their names on there, because people were embarrassed. They didn't want folk to know that they were living amongst raw sewage. And they also felt like they would be targeted, especially since the fact that that particular time the health department was actually arresting people for not having adequate sanitation. And that pushed them further into the closet instead of coming out and telling the truth. Then we also wanted to make sure that they had access to the results once we found out what those results were. And we made sure that the people that were working with us were trusted messengers from the community. And the way even before we got to the parasite study, the way we were able to do that is that we did a house-to-house survey, because nobody had ever done a house, in the state of Texas, they probably don't know how many people really in this state don't have access to adequate sanitation, because nobody has gone door to door to ask them in rural communities. So we did that. And the way for us to get that information, we made sure that we hired trusted messengers, people that lived in those communities, so if they can go and knock on those doors and ask this very personal information that people were afraid to share with just anybody, that we could get the data so that we could do the work that was needed to try to arrive at a solution. And based on that information, that was how we knew where the sewage was in the county. And that's how we were able to co-design this study with Dr. Hotez. And then once we did that, and we actually went to the communities and people were willing to talk to us. I remember the first day we went out with Dr. Mejia, who was the person, the parasitologist who came from Baylor. And Dr. Mejia had on a suit, and he was, when he went there, he kind of stood out because everybody, when they looked at him, they knew he was a doctor, they knew he wasn't from the area, and they would not give us their samples because we were collecting fecal samples. I didn't realize that it was so hard to collect fecal samples until then. Because with a fecal sample, you know, when you give somebody you give them what they need in order to give you the sample, they have to tell you the date to come back. And I guess their nerves would, their body just doesn't work like that sometimes. So when we went to pick up the samples, they wouldn't give them to us because we were with Dr. Mejia. So we told Dr. Mejia, please go back to the hotel. Let us collect these samples. So that was how we collected the samples. And he brought them back to Texas. And that's where they used PCR technology to run the tests. And they found not only hookworm, they found strongyloides, they found a number of other parasites that were associated with raw sewage. And what is important about this, with this study, was that we not only had the community engaged and involved with this, but we had to also maintain a degree of secrecy to protect the people that participated, because we knew if we wanted to go back to them again, we had to maintain that trust. It took 3 years for this study to be peer-reviewed. We knew what we had found because I was alerted about the findings. We alerted the family members about the findings, and some of the findings were different from what was written in the scientific journals. The scientific journal said that, you know, most of what was written about hookworm is that you have to be living just amongst raw sewage. You had to be walking around barefoot around raw sewage, and that's how you got, you know, infected with hookworm. But what we found, the people that had the highest percentage of the hookworm DNA in their systems were people that were paying a sanitation fee. When we found that out, then we knew we needed to look deeper. And when we looked deeper, we found out that they live next to a sewage lagoon. So what is a sewage lagoon? It's a place where, like a big pond with nothing but raw sewage in it. So there was a black community in this town, in the county seat, in Lowndes County, where there were these little nice brick homes. And they had put the lagoon behind those homes. And apparently, the way it's engineered to work is not working that way. And the sewage was backing up into people's yards, and one of the persons that we worked with, sewage was constantly backing up into her yard. And there were people all along that street that were telling us how they were getting sick. So one of the things that we did was that we went to the one black doctor, country doctor. He just happened to be the one to agree to be there at that time. And we went to see him because he had been treating a lot of the people through the community health services there in Lowndes County. And in that process, he started telling us what he was seeing. And what we realized was there wasn't even a process for him to document some of this, again, because it wasn't supposed to exist in the United States. And with all of that information, we were able to make a clear connection between sanitation and health. Is this a problem just in Alabama? No, it's not. There are places right here in Texas with the same problem. My organization, the Center for Rural Enterprise and Environmental Justice, has visited a number of areas around the country. And James, who is here with me today, we went down to McAllen, Texas. And while we were in McAllen, we went there with a group from EPA. And part of this, we visited different households while we were there. And they told us, we were the only two people there that had worked on sanitation, so they told us, don't say anything to people about sanitation. Every household we went to, they mentioned it to us. They talked about how the sewage was running back into their homes. We went to one place, the family owned a business, but they had to leave sometimes and go somewhere else to take a shower because the sewage running back into their home. We found out about people who talked about it was so bad that they ran the line to the school but didn't run it to the homes. And even going to McAllen redefined my definition of what I thought a rural community was. You know, a lot of people, when they talk about rural communities, they say, oh no, we can't put big pipe systems in rural communities because people live too far apart. That wasn't the case when we went to South Texas and went to the Colonias. There were so many mobile homes together, they could have been little towns, little cities, because there's so many people living so close together. But what we learned when we went there, and what we saw was the local ingenuity. What we saw was how people had taken nothing and made something out of it. We saw what people had built and added on to mobile homes and used. They weren't electricians, but they were connecting stuff like they were electricians. We saw the kinds of things the makeshift things that people did so that they can live and have somewhere protecting their families from the elements. But what they did not have, they made up for it in trying to do the best they could under the circumstances. But we realized that that is a major problem. We were told that from Texas to California, all along the border, that there are various places they're called the Colonias, and they are having the same issues that people had in Lowndes County. When I went to West Virginia, I saw the same thing. The only difference in West Virginia is that most of the people in West Virginia that are having these issues are white. And I told them we need to have an exchange program, that people from West Virginia need to go to Alabama and Lowndes County so they can see how they're living. They're living the same way. They have more in common than what's different. And we have found out that the sanitation issue is major around the country. I had one person call me from Washington State. He said, Catherine, he lived in Seattle. He said that his house was on a septic tank, because we assumed that all the septic tanks were in the country, in the rural communities. He said his house was on a septic tank. And he said that he was getting ready he had accepted a job in New York, and he was going back to New York, and he said, Catherine, it's very seismic here. He said, and a lot of the tanks, the pipes have separated from the tank, so the sewage is going directly into the ground. And he said that he was trying to sell his house, and he had to figure out a way to fix that before he could sell his house, because they found that out on inspection. So these kinds of problems are not just in rural communities. These infrastructure issues are around the United States. But what amplifies it in a lot of these rural communities or that the lack of resources, the lack of medical care, and the lack of government investment in making sure people have infrastructure that should have been there a long time ago. And one of the things that we learned from COVID, because the irony of our situation was that, you know, our health department at the time misguidedly put on their website that our parasite study was not valid because we used PCR technology that had not been approved by FDA. They were so short-sighted, in fact, that they didn't know that COVID was coming. And one of the ways in which they used to diagnose COVID was PCR technology. So, you know, fortunately, we had the genius of Peter Hotez and his team working with us that had an understanding far beyond the understanding of the people that we had to deal with at that time in Alabama. But what we learned from this is that people that are living in those kinds of areas, especially based on our experience in Lowndes County, had the highest death rate from COVID than anyone else. Lowndes County has a very small population, but per capita, it had the highest COVID death rate in the state of Alabama. And I submit that it was largely because people were living without the proper sanitation that had already weakened their systems. And what you find is a lot of comorbidities in these areas because they not only don't have adequate sanitation, they probably have diabetes, they probably have high blood pressure. There are so many people in Lowndes County with diabetes and are on dialysis. They have a bus running back and forth between the dialysis clinic and to people's homes so they can have the dialysis treatment. We have to do better. We have to figure out, I think the United States has all the resources to be the model for public health. We can do it right. We can figure out ways in which we can work with these communities, identify these problems, and try to find solutions. One of the persons that I got a chance to meet along the way in this journey was a doctor named Paul Farmer. Have any of you ever heard of Dr. Paul Farmer? And what Dr. Paul Farmer did, one of the models that he talked about when I met him was what they were doing in Haiti with the AIDS epidemic and how they used people from the community to help provide, not only help educate people about AIDS, but also about the medication that they needed to take. So that model that Partners in Health use is a good model if one wants to find a model to use. But in terms of working with the community to try to find those solutions. We have gone around the world, and recently we were in Italy, and there we actually met someone who invited us to come to the UK because they live in a rural community there and their septic systems are not working either. So we need to find out what type of technological changes we need to make in order to make sure that we protect the public health of everybody. Because my concern about these issues is that the next pandemic may not start somewhere else. It could start here in the United States. When we have issues of raw sewage on the ground in communities where it should not exist, and it has not been made a priority. Part of our story is that we were able to raise this to not only national but international attention. In 2023, I was invited to the White House. And they had, and I'm just going to tell the story because it's a funny story, but I got on the call saying, Catherine, we need you to come to the White House on this particular date. Can you come? I said, no, I can't come because my granddaughter is about to be born. And I told my daughter I was going to pick my grandson up from the hospital and bring him to my house when my granddaughter is born. They said, no, we really need you to come to the White House. Could you at least tentatively say you can come? I said, let me talk to my daughter first. But they didn't tell me I was meeting the president. So it was, I think they called me on a Monday. So by that Tuesday, they called me again and said, could you at least let us know something about whether or not you can come? So I talked to my daughter and I told her, I said, well, they want me to come to the White House. I said, I'm gonna go in and make my reservations, but my granddaughter's name was Halo. I said, if Halo is not born at this time, then I'm not going. So anyway, my daughter called me about 2 o'clock that Wednesday morning saying, Mom, Halo is on her way. So that Thursday, I flew to Washington. That Friday, I was at the White House in the Rose Garden. I had never been in the Rose Garden before, so it was an honor for me to be there. I thought I was just going to be in the Rose Garden. And they told me that I would be introducing the president. So they took my purse, took my phone, and they said, they told me that we want you to go to this area and sit and wait. So I went to this area, and I realized I was outside of the Oval Office. And I was kind of nervous because I couldn't take pictures or anything so I could show people that I actually was there. So I actually, when I went into, when they finally told me I could come into the White House, I said, is there anybody here that can take a picture? But they had their own photographers. So I was sitting there when President Biden walked into the office. And he came to me and he said, hi, Grandma. I said, wow. He said, you know, I got something for you. He said, but I want you to know I've been to Selma many times, but I didn't know that this wastewater problem existed in Lowndes County. He said, but I assure you that I'm going to do something about it. And then he took the rest of the time he was there to take me around his desk and show me pictures of his grandkids. And then we were told that, well, they're going to play Hail to the Chief, and when they play Hail to the Chief, you need to walk behind the president. So I was like, wow, that's kind of antiquated. But anyway, I was willing to do what I was asked to do. So when they started playing Hail to the Chief, he said, there's a step over here. Let me hold your hand. So he held my hand. I don't know whether you've ever seen the picture, but the picture is a picture of the president and I holding hands walking out to the Rose Garden. You know, some people were joking me about it, like Al Gore said, was he really trying to keep you from falling off that step, or was he just trying to be fresh? But no, he was really being a gentleman. So it was, it was a highlight of my life that week to have my granddaughter to be born, and I also had the opportunity to meet with the President of the United States. I had the opportunity as a young girl from Lowndes County, Alabama, who was told that nobody would be interested in wastewater, especially in Lowndes County, so to be at a point where I had the opportunity to walk out and introduce the President of the United States. But I wanted to say, I'm saying all this because I want you to be hopeful, because we're at a bleak point in history right now. When I first started out, all I heard was all the naysayers telling me that I needed to do something else. And I started off doing this in 2002. It was 2023 when we finally were able to make some progress. Then, of course, last year, that progress was halted because somehow it was framed as illegal DEI. And the resolution that we had made with the health department in order to fix the problem in Lowndes County was brought to an end by the current administration. But I believe that they came to that decision because they've never been to Lowndes County. I think they came to that decision because they've never been in a rural community. I think they came to that decision because a lot of people that are in Washington making decisions are making decisions about communities. They have no idea what's going on. As healthcare providers, as educators, as the experts that you are, don't make that mistake. If you're going to create policy, go to those communities. See how people are impacted. And what they didn't understand when they wrapped it in what they call DEI is that there are white people in West Virginia with the same problem. There are some people in Texas, I'm sure, that are living with raw sewage on the ground, not just in the colonias. I know that there's an area of Dallas called Sand Branch. For years, people didn't even have indoor plumbing. So these are problems we can fix. But I'm optimistic because we have to continue to educate, not just on the ground, but we have to educate the policymakers as well. so they can understand. And one of the persons that I have a whole lot of respect for is Brian Stevenson. And I don't know whether you know Brian Stevenson, but he's the founder of the Equal Justice Initiative. If you don't know, look it up. He has a movie called Just Mercy that tells his story, and a book called Just Mercy. But Brian Stevenson talks about being proximate, that you have to go there and you have to see the problem so that you can work on the problem and find solutions. And just to give you hope, I'm going to end with this story. When I received the MacArthur Award, I got a call. Actually, they reached out to me first by email, asking to talk to me. It was a family who traced their family's history and found out they were descendants of slave owners who had been they had one of the largest plantations in Lowndes County. And when I talked with one of the family members, she said to me, I want to talk with you about what we can do because we feel that our family's history is part of the problem that you're facing in Lowndes County now. And they said to me, this is what we like to do. We like to endow a scholarship for students in Lowndes County. And we're going to call it Catherine Coleman Flowers Scholars. And a few weeks ago, we were in Selma, Alabama, at Wallace Community College. Look at history. If I wasn't in a state school, I would say, look at God. But if you don't know anything about Wallace, George Wallace stood in the schoolhouse door at the University of Alabama to try to keep black students out. He was the governor. But here I was at Wallace Community College a few weeks ago with this family who had come from Boston, they came from Montana and Atlanta to recognize the students who had received these scholarships. And the students that we met were nursing students. One of the students from Lowndes County was getting ready to receive her credentials as a nurse practitioner as a result of this. And to me, that gives me hope. If this family could acknowledge their history, and they're not wealthy. They're not wealthy by a long shot. They're educators. But they came together and they wanted to do something positive. They took something bad and made something good out of it. And that's why I'm hopeful. And you are part of my hope too, because I think that you all are going to leave here and do some great things, and I'll be following you. Thank you very much for this opportunity. Thank you so much. Thank you so much.
We have time for questions. We have time for questions. If you have a question, you can come to either side and ask your question. I'm asking that you do that because our online audience can't hear you if you just ask from your seats. Dumbfounded, huh? Yeah, absolutely amazing. Amazing.
This one.
Thank you so much for sharing your story. I am actually from South Texas, Edinburgh, McAllen area, so that really resonated with me. And I actually grew up in the colonias that you're talking about. And so my question for you is, how can, if there was just a few tips of how you've seen physicians be successful at being, helping with environmental justice, right? So like that to me speaks volumes. Like how can I get involved from here? And how can I share my knowledge, my experience to kind of help those efforts that you talked about. Because I think you're right. I think a lot of that does spur disease. You know, the health disparities that we see, the chronic illnesses that we see, the autoimmune conditions that we see, they could all be traced back to all these stressors from where we live. So any tips for us who want to get involved, you know, what have you seen in the past?
Well, thank you. That's a great question. I think one of the ways in which you can get involved is document what you see. Document that, and in some cases, write about it. The other thing is doing the study, the example that we did with Baylor, working with them and actually doing the study. We've also done studies with Duke University. So just doing studies with local people that are on the ground, because some of them are great scientists. They're great scientists, but your credentials could help validate what they're seeing, and tying those environmental issues, those environmental harms to health outcomes, I think goes a long way, because a lot of times when people say that they're having these issues, folk don't want to believe them. But if the medical community is backing them up, I think that gives them the type of leverage they need to make the change that's necessary. Thank you.
Hi there. Thank you for speaking. I was wondering if you could talk a little bit about what it was like working with local administrations when you found that a particular area had sanitation issues. Were local bureaucracies willing to help, or were they fairly inflexible at a small level?
Well, I never had problems working with the local folk. The problem was they didn't have the money or the capacity to deal with the problem. A lot of the monies in these poor states, especially poor southern states, the money is coming from the federal government. And if they didn't have lobbyists to make sure that they got the money when their sewage infrastructure broke, they were just out there by themselves. So it's been, we've had good success that way. One of the areas that we worked with that wasn't a rural community was Mount Vernon, New York. The mayor of Mount Vernon, she had just been elected mayor. The infrastructure was broken. Sewage was running back into people's homes. So when we were invited to come there, that was the first trip that I made during COVID. We actually went to Mount Vernon, but when I went to Mount Vernon, I didn't go by myself. I took the chief counsel from the Natural Resources Defense Council with me so he could see it. And once he saw that, he and I wrote an op-ed for the New York Times talking about the fact that less than 30 minutes from Times Square, raw sewage was running into people's homes. And ultimately, the governor, there was an example of what happens when the state works with local people to find solutions. Governor Hochul and her staff started working with the people there in Mount Vernon, and they were able to fix the problem. We went there, was it last year? We went there to see where they had actually replaced those pipes. There was a big, they had this big machine that was in the middle of the street when I first went there that had to keep the sewage. If it was cut off for 30 minutes, sewage would start running back into people's homes. But they were able to fix that problem and remove that machine. So that was an example of working with folk. And then there are cases where people are looking the other way, but we've been very successful with folk that have called us to try to get local folk to work on solutions together.
Thank you so much.
Thank you.
Hi, thank you again so much. I was wondering, you mentioned how, you know, with the previous administration, there may have been a lot more support for public health initiatives like this, that in the current times, there's some opposition. You mentioned like the administration being against DEI initiatives. I was just wondering, what advice do you have for people who are trying to do this public health work, which in our communities is always going to need to get done, whatever, you know, names we have to put on it as far as publishing or scientific studies. So I was just curious what advice you have about continuing that work no matter what kind of times and climate we're in as far as language.
Yes. So that's a good question. A lot of us have been dealing with that challenge lately. And I think the most important thing for us to focus on is doing the work, no matter what we call it. And I think about the fact that, I guess for me, I get a lot of inspiration out of the fact that I remember when people couldn't read, you know, they were living far apart from each other and they used drums to communicate. You know, we just have to use drums. We have to find a way in order to communicate. The same thing, like I know in a lot of audiences I can't say environmental justice, but I can say environmental stewardship. I can say that God gave us, He gave this to us for the purpose of taking care of it, not creating harm. So we have to learn different ways to deliver the message. And one of the things I remember someone said that English was the hardest language to learn because you can say one thing so many different ways in English. And that's what we have to do. We have to rely on our creativity to be able to still articulate and tell the story, but we also have to make sure that we keep focused on the work and keep doing it, despite the shortcomings. And what we've decided to do is that where there's no funding, then we have to look for private funding.
Thank you.
I have a question. So we have many, many studies that are now really talking about the microbiome, which is that, you know, microbiology of our GI tracts that, you know, is relative to what we eat, where we live, the water we drink, and the connection that it has to other disease. Are you aware of studies that are looking at, by area, the microbiome of a community anywhere and its connection to disease entities, whether they be immunologic or cardiovascular, because there are some connections there?
I'm not aware of any studies personally. I do know that it is important. I do know that one of the things that I've seen people do since COVID is testing sewage to see what is happening there in terms of disease and to be able to predict them before people start showing up at the doctor's offices and the hospitals, whether there's an increase in COVID infection or other kinds of infections. We're also seeing where some people are looking at, I've seen some studies where people are looking at how you can maybe even use that to tailor treatment to people for certain diseases. But we haven't personally been involved in any, but we would like to be involved, because one of the things that we found out in marginalized communities particularly, we are not represented in studies. A lot of times we're not represented in studies, we're not represented in trials, and they sometimes impact us differently. So one of the things that we're looking to maybe potentially partner on is encouraging people to participate in these studies, because, you know, because of Henrietta Lacks and because of Tuskegee, a lot of people of color are afraid to participate in studies, but it also does us a disservice when we don't. But I think when we have trusted partners like you here at UT Southwest, we should be able to do that.
Well, thank you so much for an enlightening and really, really fantastic lecture. We thank you for sharing your story, for giving us all something to really think about.
Thank you. Thank you.
And we have a small token of our appreciation. We want you to remember UT Southwestern in a very positive way.
Oh, thank you so much. Thank you. Thank you.
Thank you all for attending. Our next lecture is March 18th. Dr. He, who is one of our public health faculty, will be speaking about his work in cardiovascular health, particularly in Louisiana, between rural and urban communities, looking at hypertension and other cardiovascular factors, and we look forward to that talk. And other work that the institution, our office will do is next Wednesday. We will host the Black History Month celebration month in this classroom. This is 602. In 602 at the same time on next Wednesday. Thank you all. Have a great day.